So this is for those of us with patellofemoral pain or anterior knee pain. So that is sort of pain in this sort of region here, through the front or through just outside, on the outside of your knee. What happens is our patella, our kneecap, this guy here in green, he sits in this nice little horseshoe-shaped piece of cartilage here. When you bend your knee, your kneecap rolls and slides through there. If we flip your knee around and show you the kneecap from behind, what you'll see is that it is also covered in cartilage. That's a cartilaginous surface there. So those two surfaces, they roll and slide together. They're self-lubricating and they move really nicely. What can happen though is because your kneecap, your patella is a sesamoid bone, if we throw another layer of quad over the top here, you'll see that it's not actually attached and it sits in that white stuff there. That's your quad's tendon and your patella tendon. So your knee muscles, the muscles of your thigh, your quads, they run from outside to in, and when they get tight, they'll pull your kneecap out to the side where that mouse pointer was going. What happens when your kneecap gets pulled out to the side like that? When you bend your knee, so walking downstairs, the bottom of a squat, your patella rubs on that surface there and we can get a pain response. So that pain response is patellofemoral pain. We're going to go through some things to show you how to stop getting that. So when we're getting that anterior knee pain or that pain underneath our kneecap when we're in the bottom of a squat, walking downstairs with a bent knee, what we want to do is we want to offload our knee while we strengthen it back up and while we get everything working a little better. So the first way we're going to do that is with a squat. What I want you to think about with your squat is making your hips do more moving than your knees. So most people when they squat will lead with their knees and they'll go forward like this. I want you to sit back like you're sitting down on a chair and stand back up. If your hips are coming backwards and forwards, your knee's going to do a whole lot less work, right? The other thing to think about while we're in that position is what your knee is doing relative to your hip. We like to talk about your knee going where your hip drives it or where your hip allows it. So when we're in this position at the top of our squat, if you take your knees and you turn them out, put your hands on your butt, you'll feel it turn on. I want you to keep your knees outside your big toe, in line with your second and third toe while you squat. What that's going to do is that's going to externally rotate our femur, or pull our femur out this way. It's going to keep that kneecap sitting in the groove really nicely. So that's exercise one. Simple little squat, only squatting as deep as you can before your knee starts to feel sore. We don't want you to sit down and squat into pain. If that point there is painful, stop your squat there, okay? So we're working away from pain, loading hip up, not loading knee, okay? For exercise 2, we're going to use a step. This can be the bottom step of a set of stairs at home. It can be like a little recess thing you've got in the house. What we're going to do is we're going to hop on the edge of that and we're going to slowly lower like a little mini squat. So we're going to stand on here, hip, knee, foot are in line. We're going to gently lower until our other foot touches the floor and we come back up and lower, come back up. What I don't want to see is our hip shooting around like this, or our knee coming in like this. When we do that, that internal rotation, your patella, your kneecap ends up in the wrong spot. So give those 2 moves a go. See if they make a difference to your run, your ability to squat, your knee pain on a bent leg, and let me know.